may be asking, how do we figure out if MTHFR is actually affecting my child? So there's a couple of ways that we test this. We do genetic testing. So this shows me exactly what the variant is that your child has. And there's different ways that you can do this through functional lab testing. It is something that does need to most commonly be ordered by a coach or a provider for you. You can go through the 23andMe companies, but I really prefer a comprehensive panel that look at multiple methylation related genes and not just MTHFR because it might just be a piece of the puzzle that we're not looking at the whole entire picture of. The other part where I come in is the functional testing. This is where we look at actually how the methylation works, how it's getting broken down in our child's body. And we can actually test for methylfolate levels, not just folate. And we can look at the homocysteine levels, which is actually seeing if it might suggest that we have a methylation problem. You can look at histamine levels and organic acid to show if there's any methylation metabolites. And really, it just looks at a much deeper level and a cellular level of your own child's function in their body. We can also do clinical assessments. So sometimes the pattern is clear that we make an educated guess based on decisions or symptoms that have been told to us or family histories, especially if our genetic testing isn't feasible. But really, I want to be clear that genetic testing will tell you exactly the variant that your child has. Functional testing will tell you how those variants are actually affecting your child and affecting their body. And most with both of those pieces of that information are incredibly valuable to how to treat your child individually. In my practice, I often see children that parents have done the genetic testing through the 23andMe or any of the ancestry, those kind of things, and they've discovered the MTHFR variant, but they don't know what to do with that information. And that's where the functional testing and proper interpretation of the testing becomes crucial.